Hello, welcome. I'm Janak Goyal. Let's look into some of the common procedures of hip under sonographic guide. Let's review the anterior hip anatomy before considering the hip joint injection. The hip joint is located deep to the anterior hip muscles sartorius, iliopsoas, and rectus femoris. Here is your hip joint capsule, and looking into this image, here is the sartorius, iliopsoas, rectus femoris, acetabulum, femoral head, and here is your hip joint capsule, and here is your labrum. For injection of the hip joint, the patient is placed supine with slight external rotation of the hip. The transducer is placed on the neck of the femur, which is oriented from the mid-inguinal point towards the greater trochanter, and the needle is inserted from the lateral to medial into the anterior recess of the hip joint. Here is your animation. You see the needle getting inserted into the anterior recess of the hip joint, and here is the position of the needle as related to your transducer position. The iliopsoas bursa lies deep to the iliopsoas tendon between the hip joint capsule and the iliopsoas tendon. Here is your iliopsoas tendon, and here is your hip joint capsule, and here is your iliopsoas bursa lying between the iliopsoas tendon and the hip joint capsule. On a longitudinal scan, what you're looking at here, you're looking at iliopsoas muscle and tendon. Here is your hip joint capsule, and here is the femoral head and acetabulum. Here is your iliopsoas bursa, and here is the rectus femoris and sartorius up there. For iliopsoas bursa injection, the transducer is placed between the anterior superior iliac spine and the greater trochanter, with the medial end pointing towards the femoral head. Here is your anterior superior iliac spine, here is your greater trochanter, and here is the positioning of the transducer. The needle is inserted from lateral to medial with the careful attention to the femoral vessels. Here your needle coming from lateral to medial, and you need to pay careful attention to the femoral vessels. You must be lying somewhere here. At the lateral hip, the greater trochanter is located at a hand's breadth inferior to the midpoint of the iliac crest. The bony surface of the greater trochanter consists of 4 facets: anterior, lateral, posterior, and spiro-posterior. For trochanteric bursa injection, the patient is placed in a lateral decubitus position with the affected side up. Trochanteric bursa can be injected from any direction based on your choice and based on the patient's and your own comfort. Here is the subgluteus medius bursa being injected from proximal to distal approach. Here is the positioning of the transducer, and here is the positioning of the needle, and here you see the needle coming from proximal to distal and getting into the subgluteus medius bursa and filling the space with the injection material. And here is the animation drawing, which is showing your needle getting through the gluteus medius, getting into the subgluteus medius bursa.